parts of the respiratory system. The respiratory system does more than breathing. It also allows you to talk, smell, it warms air to keep the body at a stable temperature, and it moisturizes the air. It delivers inhaled oxygen to the blood to be distributed to the body cells. It removes waste during exhalation, and it protects the airway from harmful substances and irritants. There are many parts of the respiratory system. First is the mouth and nose. The mouth and nose bring air into the respiratory system. The sinuses are a hollow area of the head between the facial bones that regulates the temperature and humidity of the inhaled air. The pharynx, or throat, is a tube that connects air from the mouth and nose to the trachea, or the windpipe. The trachea, or the windpipe, is a tube that connects the throat to the lungs. The larynx is an area in the trachea, also known as the voice box. It vibrates to produce the sound of your voice. The bronchi are where the trachea branches into two tubes to enter the lungs. The lungs are the organs responsible for the exchange of oxygen and carbon dioxide. The bronchioles are smaller and smaller tubes, sort of like an upside-down tree, that delivers air to the alveoli. The alveoli are air-filled sacs that perform the exchange of oxygen and carbon dioxide with the blood. The pleura are thin sacs that the lungs sit in, preventing friction when the lungs expand and contract. And the diaphragm is a muscle at the bottom of the chest cavity that helps create the negative pressure to pull air in and the positive pressure to push it out. Ribs are flexible bones that surround the lungs and heart, providing protection. Cilia are tiny hairs that line the nose, throat, trachea, and bronchioles that move in a wave-like motion to filter dust and other irritants out of the airways. And the epiglottis is a flap at the entrance of the trachea that closes when you swallow to keep food and liquids out of the airways. There are two lungs in the body, but they are different sizes. The right lung is larger and is made up of 3 lobes or segments. The left lung is smaller in order to make room in the chest for the heart. This lung only has 2 lobes. There are 2 main functional reasons why someone would not be able to breathe. The first would be an upper lung blockage. This can be caused by inflammation or obstruction at the area of the throat, trachea, or bronchi. For example, bronchitis. In this case, the person would be unable to bring air into the lungs. The second reason is a lower lung blockage. This can be caused by a buildup of fluid or damage done to the alveoli. The person can bring air in, but the gas exchange is impaired. The body brings oxygen in and gets rid of carbon dioxide through inhalation and exhalation. During inhalation, the person breathes in and the diaphragm pulls down. This causes a vacuum or negative pressure that causes the air to rush into the lungs. During exhalation, the person breathes out, the diaphragm relaxes, and this allows the lungs to deflate.